Hello, good morning to all. I am Professor Manavalam working in SNS College of Nursing. Today we are going to discuss a small topic on current trends in nursing practice. So what are the trends we are setting in the nursing practice and doing in our day-to-day operation that we are going to see in detail briefly in this. Trends means it is nothing but a change or development that occurs towards a certain direction according to the changing situation and environment. Nursing profession is a continuously evolving and dynamic profession. It is influenced by the day-to-day advancement of technology, newer technology that will introduced into the nursing services. And same time, the healthcare policies also getting upgraded according to the changing situation or environment or disease condition. And the meanwhile the growing the demands of patient care because of global migration and emerging of new pandemic diseases, increasing the geriatric population, increasing the younger generation and the cultural diversity population living in all kind of people they are living in different countries. So because of these reasons there is a growing demand of patient care in a different way. All these things combined together and is setting a new changes in the nursing profession, and the nurses they are very ready to accept and move on towards the trends. So what are the some of the trends commonly used in nursing profession? And that first one is the telecommunication. Telecommunication, it is accelerated in the time of pandemic. After that it is more popularized. Many of them they are getting consultation through using the telecommunication. It is nothing but it is transferring of health information over a distance through using the electronic devices. It is enhancing the accessibility. Definitely most of the population they are living in Indian scenario, they are living in the remote area, many of them in the geriatric condition, geriatric patients they are not ready to access the healthcare service because of difficulty in traveling and getting the healthcare services. But this telehealth, it is giving the door-to-door delivery of health services. So it is through that it is enhancing the accessibility of healthcare services to all sectors of people. Next, remote patient monitoring. So here the nurses no need to go to the patient bed or patient home to monitor the patient continuous progress of patient condition. They can make the use of smart apps, smartphones, tracking devices to track the sleeping pattern, to track the food pattern, to track the weight pattern, to track the heart rate, and they can track the blood sugar level also. Through that they can monitor the patient be in the hospital and they can give the healthcare services. It is improving the outcomes absolutely, because many of them because of difficulties in accessibility of services, difficulty in travel over period of time, they are not ready to access the healthcare services. Meanwhile we are ready to provide the services as in their home itself. Means definitely many of them they come forward and get the healthcare services so that the health status of the society will improve. It is increasing the efficiency. Definitely it is reducing the healthcare cost, and also it is reduce the manpower usage and material usage. Through that we can bring out the quality and efficient healthcare services. Next one is integrating the technology. By integrating the technology into nursing practice, what are the advantages are there? They can focus more on the patient care instead of spending more amount of time for manual work. So they can use the technological instruments to monitoring the patient status. Through that they can spend more of their time for direct nursing care. It is helpful to enhance the patient engagement because we are spending much of our quality time with the patient and having the good interaction. Through that we are making a mutual trust with the patient. It is increasing the sense of satisfaction. It helps to improve the documentation because manual work it engulfs most of the quality nursing time. So at the same time there is a chance of making error. So the electronic devices it is maintaining the accuracy and the completeness of the records. So nowadays most of the hospital sectors they are changing the manual records into electronic health records. So this is also very much helpful to save the time as well as the spoiling of records. So they can maintain the record in good position and it is easy accessible to everyone. Nurses they are using different types of mobile apps to monitoring the patient vital signs like heart rate, blood sugar level and administration of medication, providing health education and counseling. So it is streamlining the process. Definitely every process or every task automated in the system. So it is giving guidance for us what task we have to complete first, what task is next. So through that it is optimizing the workflow for providing the efficient care. Evidence-based practice. So evidence-based practice it is integration of best possible practice that is bring out from the research and we are integrating that best possible results with clinical expertise and patient values. Through that we can enhance our reputation, improving the health results because we are giving the informed care to the patient. Everything is based on best possible and also we are getting the clinical expertise consultation because they are very much skillful and knowledgeable in their own sector. So we are getting information from them and we are putting together into best possible research which is held from the research. So everything is informed to the patient. We are giving the different choices because we are having n number of sources in our hand or best possible evidence in our hand. So we are giving every evidence into the hands of the patient. We are making them to make a choice. Through that we can bring out the better results. Nurses nowadays they are involving more number of nurses involving in the latest research in order to making a clinical decision. Interpersonal collaboration. When different interdisciplinary persons they are working together in order to achieve the common goal set by the hospital, that is called as interprofessional collaboration. It is very needed one because nurses not only single person providing services to the patient. It is a interdisciplinary approach. The doctors, physiotherapist, lab technician, pharmacist, everyone they have to sit together, share their understanding about the patient. They may have to make a good open communication about the patient condition and they have to take a sad decision through that they can avoid making mistakes and they can provide the efficient and quality health services to the patient. It helps to improve the patient outcomes. So these are all the certain trends commonly used in healthcare services, mainly in nursing sectors. I hope everyone understood very well about this. Thank you all.